The ACL is a critically important ligament to stabilize the knee for cutting and pivoting sports. Therefore, in young individuals who suffer ACL injuries that want to continue to participate in sports that involve quick change of direction movement, surgical intervention is necessary in order to stabilize the knee and prevent further damage from occurring. Because the ACL is incapable of healing itself, surgery is necessary in order to replace the ACL with another type of ligament graft to allow the knee to become stable. ACL surgery has undergone many advancements over the years. Currently, the surgery is being performed arthroscopically and done as an outpatient. That allows for patients to have much less pain initially after surgery and avoids any large incisions around the knee. Because the ACL is a ligament that is incapable of healing itself, a surgeon needs to replace the ligament with another type of tissue called a graft in order to reconstruct the ACL and allow the knee to become stable again. There are three main options that a surgeon will offer a patient in terms of graft choices for ACL reconstruction to be performed. The first choice is using something called the patella tendon. Patella tendon is a structure that runs from the kneecap here to this bump on the top of the shin bone here, and it's responsible for allowing the knee to extend. For ACL surgery, the central 1/3 of this patella tendon is harvested and used to reconstruct the ACL. Once this graft is taken, a small drill hole is made in the shin bone and on the thigh bone where the ACL normally would insert. And that graft is passed in the same direction as the normal native ACL and held in place by screws to stabilize the graft and keep it in appropriate tension. The advantage of using a patella tendon as a graft source for ACL reconstruction is many. First of which, it's one of the most well-studied graft choices for ACL surgery. It has one of the longest track records in terms of restoring stability and proper healing for highly competitive athletes. Therefore, it is oftentimes considered the graft choice that is preferred for the highest level of competitive athlete. The downside to using a patella tendon as a graft choice is that it's typically the thing that causes the most significant pain initially after surgery. So patients who have a patella tendon graft need to be highly motivated through the initial physical therapy and rehabilitation process in order to have an optimal outcome. Another disadvantage of using the patella tendon is that a small percentage of patients will complain of some soreness in the front part of their knee with kneeling, squatting, or other direct pressure applied to the knee. If that occurs, it's usually only mild and usually resolves over time. But certain individuals that spend a lot of time on their knees, either through their sport or through their occupation, a patella tendon may not be the ideal choice for an ACL graft. Another option for ACL reconstruction are using a patient's own hamstring tendons as a graft choice. The two tendons that come down and attach to the top inside portion of the shin bone here are called the gracilis and semitendinosus, and those tendons can be harvested through a small incision right here along the edge of the shin bone and used to reconstruct the ACL. Those tendons are passed into the knee joint through a small tunnel created in the shin bone and the thigh bone, similar to the way a patella tendon would be used, and the graft is again placed in the same direction as the native anterior cruciate ligament and tensioned appropriately so that it provides appropriate stability to the knee. The major advantage of using a patient's own hamstring tendons for an ACL graft is that it's still the patient's own tissue, and the results of restoring stability and return to sport are nearly equivalent as using a patella tendon graft for ACL reconstruction. The major advantage of using hamstrings as opposed to the patella tendon is the avoidance of the anterior knee pain that can happen with using a patella tendon, as I had mentioned previously. Additionally, there's less risk of injury to the cartilage on the back side of the kneecap and the end of the thigh bone, which can sometimes happen when the patella tendon is used as an ACL graft choice. The hamstring tendons have shown to provide reliable results in terms of return to sport and provided excellent results in terms of restoring stability to the knee, and therefore, in somebody who wants to avoid the anterior knee pain that can be associated with using a patella tendon graft, I think a hamstring autograft or a patient's own hamstring tendons is an excellent alternative choice. Another graft choice would be to use donor tissue called allograft tissue. And there's many different types of allografts, whether they be patella tendons, Achilles tendons, or other soft tissue tendons that can be used. The advantage of using allograft tissue is that no tissue is taken off the patient's own knee for the surgical reconstruction. That involves less pain initially after surgery, and rehabilitation and physical therapy is usually easier in the first few weeks. The downside to using allograft tissue is that it is more expensive than using a patient's own tissue. Also, the healing time for allograft tissue is typically longer than a patient's own tissue, and thus the full return to sports in a safe manner may be delayed compared to an athlete who has their own tissue used for the ACL graft. One of the major disadvantages of using an allograft for ACL reconstruction is the potential increased failure rate in young athletic individuals. There's been some recent evidence that suggests that the use of allografts in patients under the age of 25 may have a higher failure rate than using the patient's own tissue. The reasons for that are not entirely clear, but may result from the allograft tissue taking longer to fully incorporate and heal, and a younger athlete's desire to want to return to sport in a more timely fashion, and thus the patient may be going back to sport prematurely and putting their reconstruction graft at risk. Although we don't know the exact answers as to why allografts may have a higher failure rate in younger individuals, it is certainly something that the patient should be advised about in order to make the proper ACL graft choice for their individual needs.